Hello, my name is Pamela Case, and I appreciate your consideration for this award regarding my construction of pre-lab preparation activities using Qualtrics for student learning of psychomotor skills. The residential physical therapy program was challenged during 2020 with transitioning to mostly distance virtual learning with only pre-approved essential labs on campus for students to learn necessary psychomotor skills. Learning and mastering psychomotor skills is an important component of physical therapy education, and courses that I teach, Biomechanics 1 and 2, have many psychomotor learning objectives. Faculty search for methods to make lab times as productive as possible for students to achieve beneficial learning outcomes. To address this challenge, I searched the literature and found a case study and supporting literature review written by a physical therapist educator concerning psychomotor skills in an online hybrid course. The author, Lazinski, discovered that face-to-face time constraints emphasized the need for students to arrive to lab having already been introduced to certain skills with basic understanding. The case study was developed in response to findings in the literature. A. Technology-facilitated teaching and learning activities supplementing traditional instruction resulted in favorable outcomes, and B. Supplemental computer modules with embedded video and content review questions resulted in physical therapy students that had better clinical reasoning and learning outcomes compared to traditional lecture and lab alone. I found inspiration from a colleague, Christina Chuka, on how to build supplemental computer modules with embedded video and content review questions. Through collaboration with Dr. Chuka and Brittany Williams through the TLC, I created the Qualtrics modules as a solution to address the described challenge. These supplemental computer modules with embedded video and content review questions were built using other course and university resources. PhysioU is a standardized online reference tool using clinical-based guidelines, and it is a required resource for students across multiple courses in the physical therapy curriculum. Qualtrics is a powerful online survey tool that allows for building and distributing surveys with programmed logic and analyzing responses. And Canvas is the online course platform used by the university. These learning modules were integrated into the physical therapy biomechanics courses. Self-paced Qualtrics modules were created using logic-programmed learning pathways structured around videos demonstrating psychomotor skills and linked through the Canvas course platform. By completing these pre-lab preparation activities, students viewed demonstrations along with verbal explanations of psychomotor techniques prior to scheduled lab times to maximize hands-on practice when on campus with fellow students. This technique is innovative because it integrated the technology-based resources of PhysioU, Qualtrics, and Canvas to facilitate student learning in a course that is heavily weighted towards development of psychomotor skills. The modules are self-paced, which allows students to take more time as needed to process the components of each psychomotor skill through watching and rewatching the video demonstrations, slowing down the playback speed of the videos to observe more details, and pausing to take notes as needed without missing part of the demonstration. Traditionally, these courses involve live demonstrations of skills in lab that the students do not have access to rewatch outside of lab. The pre-lab modules eliminated the need to frequently start and stop to provide live demonstrations during in-person lab time. Lazinski had discovered that face-to-face time constraints emphasized the need for students to arrive to lab having already been introduced to certain skills with basic understanding, and these learning modules met that need. Implementation of this innovation is not difficult, but it is time-intensive to create. However, once created, the modules can be employed in future iterations of the course with minimal setup time required. Additionally, once the first module has been created, it can be used as a template for subsequent modules across the course or other courses, which reduces time required for creation. This idea can be modified and adapted to fit any course or content, as Qualtrics modules are very customizable. Also, this option can be incorporated into a course as much or as little as is beneficial. There was no monetary cost associated with implementing this innovation, as the idea made use of resources already available through the university or required for the students. The first-year Doctor of Physical Therapy students were impacted by this innovation. Since it can be customized to other educational content areas, other students and instructors can benefit from this technique as well. The 2020 cohort of students expressed concern that their education would suffer due to decreased time on campus for practice and refinement of psychomotor skills. However, upon comparison between 2019 and 2020 biomechanics course grades, that was not found to be the case. Student rating of teaching scores increased as well. As an example statement from the 2020 student ratings of teaching, a student expressed, "I loved how the Qualtrics modules help prepare us for lab, especially with the shortened time on campus." This teaching innovation supports the ATSU core professional attributes of critical thinking, interpersonal skills, and interprofessional collaboration. Incorporating these pre-lab preparatory activities allows students to gather additional information from across courses or from available evidence as they prepare to apply critical thinking and enhance their decision-making. Students understand that the more prepared they are for lab activities, the more time they have for practice and refinement of psychomotor skills, alongside refining their verbal and nonverbal instruction and communication to further develop their interpersonal skills as future clinicians. These factors foster responsibility, accountability, and teamwork among students and their lab partners to arrive prepared for lab. Thank you for considering this innovation for the ATSU Innovation in Teaching for Learning Award, as it addressed challenges faced by the students and faculty during the 2020 pandemic and involved considerable steps of growth for the instructor as a physical therapy educator.